Hello, ladies and gentlemen. So it is, I think, the 16th of July already. Time flies. So just going to go over another two topics just for your information purposes. So I'm going to talk about the downtime that you need from work, social activities, and when can you expect the final results from pretty much everything I do, which obviously if you've been on my or listening to these broadcasts, you know that I specialize in facial rejuvenation surgery, lifts, brows, whatever, and rhinoplasty. So there are two distinct areas. Rhinoplasty I'll start with. The average, we're going to talk about virgin noses now, not revision rhinoplasty. So the average rhinoplasty youngster just wants to have a better looking nose. It's done closed, so there's no visible incisions, so you don't have to worry about that, and for the most part. And there's 2 weeks of having something on your nose. First week it is cast. Second week it's some tape. So those first week you're not going to want to work. I can tell you that the average patient doesn't complain of pain that first week. They complain mainly of the difficulty breathing through their nose. Just had surgery, and there's some packing, and they complain about being tired because you don't sleep well. You got to sleep with your head slightly elevated. So that first week you're not going to work, and you're going to look definitely like you had surgery. Second week after rhinoplasty, most people, or a lot of people I should say, not most, I'm not sure exact percentage, but a lot of people go back to work. The cast is gone. Any bruising that you may have is either pretty much gone or gone enough that a little makeup doesn't look too bad, but you will have tape on your nose so people will still know you did something. But if that doesn't bother you, you can go back to work because you're going to feel pretty good that second week. After 2 weeks, almost all my patients go back to work. There's no reason typically that they can't. The tape is gone, the bruising should be gone, or it should be easily able to hide it. Even at 2 weeks, your nose is already going to look better than it did when we started, but it's not done healing. So the follow-up schedule is about 6 weeks and then 2 to 3 months, and it varies a little bit depending on how you're healing. So the patent answer I give to almost every patient, no matter what I do, is that I take 6 months to a year to heal, for the final healing to occur. But that's especially true for rhinoplasty. Rhinoplasty is a complicated procedure, a lot of nuance to it. It's obviously a three-dimensional object involving cartilage and bone and skin of varying thickness, and depending on the patient's genetic background, their variabilities that involved there. So there's a lot of things going on in rhinoplasty, but on average, at 2 weeks, you look pretty good. At 6 weeks, 6 to 8 weeks, you get your first set of photos, and then typically what we're managing at that point is either nothing, or we're managing swelling from the supertip up to the rhinion, supertip rhinion. That can be persistent sometimes, and there's tricks to getting rid of it. Sometimes it's just taping, sometimes massaged and tape. Sometimes we have to use injections of what we call kenalog 5-FU. That varies from patient to patient. The average patient doesn't need shots. The average patient will resolve everything with time, massage, and plus or minus taping. So that's noses. Facial rejuvenation, that's a big broad topic, anywhere from getting brows looking pretty, the lower lids looking pretty, an aging face looking pretty. Obviously there are other things like chin implants and cheek implants, so those are all kind of in the same category. For my face, let's say we're doing a makeover of the face, to make for aging purposes. That usually, for the average patient, involves something with the brows, something with the lower lids, and a deep plane of something, either your deep plane lift here or possibly including here, depending on the patient's needs. With that in mind, you're definitely going to avoid working for about 2 weeks. All right. first week, there's not a lot of improvement in swelling, and bruising seems to just kind of be stagnant. Second week, you see a drastic change, with a lot of improvement in the appearance of the postoperative of your face. But at 2 weeks, you're still you, the patient, are still going to notice that you're swollen, and there may be minor residual bruising. Usually it's pretty much gone. But most patients at 2 weeks go about their business without getting too many comments or worry about people looking at them at the grocery store or whatever. So most of my gals and men go back to work in 2 weeks. I tell all my facial rejuvenation patients, do not schedule any major social events where you want to look your best, like a wedding or whatever. You're going on a big trip or with friends or something like that. You don't want to do that until you're at least 6 weeks post-op, preferably 3 months, 6 weeks to 3 months, somewhere in that time range. At that point, you're going to start feeling glamorous on average for the vast majority of patients. Even though you're still healing, there'll still be some spots of numbness, but you're going to just look great. Okay? So the final healing, again, will take 6 months to a year, but you look pretty darn good at 6 weeks to 3 months. So that's kind of how that goes. I hope that's helpful, and we'll see you next time.